that are online. If you have a question, please raise your hand and we will give you the floor to ask your question. With me here, I would like to introduce, first of all, our regional director for the East Mediterranean region, Dr. Ahmed Al-Mandari, and Dr. Rick Brennan, our regional emergency director, and myself. My name is Iman Shankiti, and I'm the WHO representative in Damascus. I would like to give the floor to Dr. Ahmed Al-Mandari to present, what he saw today in the field, and then maybe we take it from there. Dr. Ahmed, the floor is yours.
شكرا جزيلا إيمان. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. جزاكم الله خير جميعا على الانضمام لهذه الإحاطة الإعلامية مؤتمر الصحفي. طبعا كما ذكرت إيمان، يعني وصلنا إلى سوريا خلال اليومين الماضيين، وقمنا بزيارات ميدانية إلى محافظة اللاذقية والمناطق المحيطة بها، وحاليا موجودين في حلب. قمنا بزيارات ميدانية، فقدنا بعض المواقع، ويعني كما هو ظهر في وسائل الإعلام المختلفة، هناك فعلا كارثة حقيقية أصابت هذه الأجزاء من سوريا. يعني تهدمت الكثير من المباني، عدد كثير منها كذلك يعني آيل للسقوط، مما أدى إلى خروج الكثير من المواطنين يعني نوعا ما إلى أماكن إيواء مختلفة، في المساجد، في الكنائس، في المدارس، في الصالات الرياضية. فقدوا الكثير من أهاليهم، وقصص مؤلمة جدا جدا. المصابين كذلك يعني عدد كبير، ولكن ولله الحمد يعني تمكنوا من حصول خدمات صحية. كمنظمة صحة عالمية موجودين ولله الحمد منذ اللحظات الأولى على أرض الميدان بتقديم يد العون والمساعدة بمختلف الطرق، وفيما يخص يعني إيصال المساعدات الصحية والمستلزمات الصحية للمؤسسات الصحية، تقديم المشورات، تقديم التدريب اللازم. يعني المصاب جلل، ولكن بفضل الله سبحانه وتعالى وهمة الجميع، ومثل ما همة الجميع أنا على يقين بإذن الله أن سنتمكن من التغلب على هذه المصيبة وعلى هذه الكارثة، وسنخرج منها بأقل الأضرار وبقصص نجاح كثير. وكذلك يعني خدمة أهلنا في سوريا، ندعو من الله سبحانه وتعالى أن يوفق الجميع، وأنا يعني نطلب من الجميع أن يمد يد العون والمساعدة بمختلف الطرق، سواء للمنظمات الأممية وغير المنظمات غير الأممية، وكذلك المؤسسات الحكومية في مختلف المواقع. شكرا جزيلا. جزاكم الله.
Thank you, RD. I would like to give the floor to Dr. Rick Brennan. The floor is yours.
Thank you, Iman. Assalamu alaikum, fellow colleagues. We've been here on the ground in Latakia and Aleppo for a couple of days now, and everything you've seen on the television screens, we've been able to witness to. The scale of devastation is enormous. You've heard about the thousands of deaths, the thousands of injuries. But what's sometimes obscured is
recording in progress.
The people who have been left acutely homeless. And we've been able to visit those communities, the great sense of desperation, the enormous sense of loss after 12 years of civil war, and now this acute devastation that just came on completely unexpectedly. It's pushed people into desperate situations. I think the good news is that the people have not lost their faith, they've not lost their hope. They're maintaining their dignity. We're seeing some genuinely good efforts from local NGOs, from government, from the UN. But we have to take our relief effort now to a new level. We really do have to move with greater urgency, increase scale, and get ourselves better organized, because these people absolutely deserve our support. We give them the resources, they can certainly help themselves. And that's certainly what we plan to do here from the World Health Organization.
Thank you, Rick. Just a few words from my side, because the WHO in Syria has been working for a long time, but during the last 12 years, WHO has been focusing on a lot of areas which are more related to humanitarian and emergency response. So what we have seen right now is way beyond what one agency or one actor can perform. I mean, what is really important is the initial needs on the ground were trauma and treatment of casualties. But what is really right now important is to focus on those that have survived, those that are staying in shelters or staying in the street, in cars or in tents. These people will need access to the basic services, be it non-communicable disease medications, be it the merest level of access to services. I mean, we have been stopped by several families on the ground asking for their prescriptions to be dispensed and access. I mean, to ensuring that they have these services at hand. So it's important to focus on, first of all, definitely ensuring that the hospitals and the health facilities are running, I mean, at least to be able to respond to the basic needs and gaps on the ground, but also to adopt a holistic approach and what is needed, I mean, in terms of shelter, in terms of food, in terms of water, in addition, of course, to health, is going to be key. Without that, we will never be able at least to meet the basic minimum of these people on the ground. We have seen a lot of devastation, and we have seen destruction, and we have seen families that are separated from each other. We have seen children without their mothers and their fathers. And what we have seen, I don't think we will ever be able to forget in the near future. So let's work together and let's ensure that we are providing one voice in order to be able to support the public and those families that have been affected in the earthquake. Thank you. So I would like to start with some media outlets that have expressed their interest to provide the questions. So Mohammed Mansour, please identify your news agency, and you can also present your question. Thank you.
صباح الخير. آسف جدا على الأخبار السيئة اللي جاية من سوريا. أنا اسمي محمد منصور، أنا صحفي في الشرق نيوز. وكان عندي هو سؤال واحد بس. بعد اليوم الخامس يعني من الكارثة، فرص العثور على الأشخاص أحياء بقت قد إيه؟ يعني هل في آمال لا تزال معلقة بالعثور على بعض الأشخاص أحياء ولا لا؟ شكرا جزيلا.
If I may, I can start, and then of course RT will be able. Yesterday evening in Latakia, 2 people after 100 hours under the rubbles were detected and found, and they were saved. So I mean, there's always hope, but of course the hope diminishes with every hour. The weather conditions are harsh. I mean, maybe today and the end of yesterday, it was a bit sunny, but they have really went through difficult weather conditions. At night, it is freezing, and people are staying in areas which are unserviced. So the possibilities diminishes with every hour, but we never lose hope, Muhammad. We never lose hope. Last night, 2 people were found in Latakia, and today we found families digging rubbles with their hands, with their bare hands. And I mean, they only had a scraper with them. I mean, I saw it with my own eyes. No heavy equipment to support them in mobilizing these efforts. But I also, of course, leave it to my regional director and Rick Brennan also to elaborate more.
جزاك الله خير إيمان. وطبعا ما عندي إضافة أضيفها اللي ذكرته دكتورة إيمان. فعلا يعني فرص العثور على ناجين بعد مرور هذا الوقت من الزمن قد تكون ضئيلة، لكن الأمل في الله سبحانه وتعالى أنه تتمكن فرق الإنقاذ من الوصول إلى هؤلاء الأشخاص وإنقاذهم. على حسب يعني لقاءاتنا مع المختصين والمسؤولين عن مثل هذه العمليات، أوضحوا لنا أنه نوعا ما يعني لم يجدوا أي من هؤلاء الأفراد يعني تحت هذه البنايات حتى الآن، لكن ما زال البحث جاري، وأسأل الله سبحانه وتعالى العون والمساعدة. Rick, I don't know, would you like to add anything?
I think you've said it all.
Okay, maybe we go to Catherine. Catherine, France 24. The floor is yours.
Yes, good morning. Do you hear me?
Yes, we hear
Okay.
you very well.
Okay, good morning. Thank you for organizing this press conference. I just wanted to mention that unfortunately I don't understand Arabic, and it would be nice if someone could maybe translate what your colleague said. Regarding what you just mentioned, I would like to know where and when do you intend to distribute some kits or medicine to the people affected? Could you be very precise in the cities or the region? Yesterday in Geneva, the Association of Correspondents at UN did have the head of the White Helmets in a press conference, and they highly were disappointed and were even angry about the lack of help that they have in the region of Idlib, that they haven't seen any help, and that the trucks that have been mentioned, 6 trucks, were in fact already planned before. So could you be precise about how you work with these people and how you're reaching the people affected? Thank you so much.
Thank you for your question, Rick.
Yeah, thanks, Catherine. So I think it's important to state that we're distributing aid in Idlib, as well as in Latakia and Aleppo and the government side, affected side as well. With respect to Idlib, you're right, we did have pre-positioned supplies, and as soon as the earthquake struck, we were able to mobilize trauma supplies to 16 hospitals across the affected area. We only had a modest contribution to those 6 trucks that did cross. We all acknowledge that there have been difficulties about getting aid into the northwest across the border. You know that it was that aid delivery was delayed for several days because of access issues. Yesterday we had a plane load of supplies come in. Well, I'm sorry, truckloads coming in from other parts of Turkey into Mersin. And we expect that we will be able to ship more trauma kits and other essential supplies in the next convoys. We do have NGO partners working cross-border in Idlib, where we've distributed supply, who will help us in that distribution. And we've got another plane load coming into Turkey for distribution cross-border on Monday. We've already done distributions in Aleppo and Latakia. And we've got another plane arriving today with 34 metric tons of supplies, working again with our government partners and NGO partners here. Iman, I don't know if you want to add any more about the distributions here.
No, actually what is important to note, Catherine, that at the first 24 hours, we did release supplies which were pre-positioned in Aleppo and in Latakia. But of course, I mean, the supplies released are not enough to cater for the needs on the ground. Additionally, I mean, with the support to Crossline, we are pushing for the trucks to go in, and they will include a lot of supplies that are needed at this stage, specifically for treating of trauma and casualty cases. So once they arrive, then we will be able to elaborate a little bit more on that.
We're waiting for the go-ahead for that cross line.
Yes, we are ready from our side, and we got all approvals from this side. I mean, no hindrance for these trucks to go forward. I would like to give Suman Munshi the floor. Please indicate also your news outlet. Thank you.
If he's not, we're not able to hear him, we're going to leave them.
Okay, Suman, we cannot hear you. We will go to the next question, and then let us know if you are ready when you are ready. So there was a question from Ali Muhammad about the magnitude of destruction, important health and humanitarian needs, and aids provided by who, and what is the health situation now? Ardi, would you like
Thank
from
you.
what you saw, of course, on the
Yeah,
ground?
thank you, Iman. As we all know, colleagues, Syria have been experiencing this war for 12 years. It has affected the healthcare system very, very badly. Many hospitals almost 50% of healthcare facilities are non-functional. And those which are functioning are, lacking equipment, lacking staff, lacking medications. So the healthcare system in Syria is very, very fragile because of the 12 years of war. And now this earthquake added to the complexity of the healthcare system. Based on what, Iman and Rakab mentioned, the visits we have made, we have witnessed people who are, lacking their medications for diabetes, for hypertension. We have seen people who have been, really looking for some support in terms of their children, worried about acute respiratory infections. In the shelters itself, we have seen, people backed into very small, tight place. In the shelters, so many families, we have seen people in small tents, sleeping together. So the needs are really huge. And that's why we call, for that help and support. And as mentioned by Rek and Iman, we have been from day one, mobilizing these supplies to different locations within the backed government-controlled area and supported by NGOs, international NGOs. In the shelters, so many families, we have seen people in small tents. We are worried about the acute phase and the critical time now have passed, but we are worried about the health conditions that will follow such acute case, and we have to really work and act fast and hard on that. Back to you.
If I may elaborate also on what RD has said, I mean, we estimate that 5 million people are affected between all different governorates that have been hit by the earthquake. But to be more specific, and these are just preliminary figures, in Aleppo, we have more than 200,000 people that are homeless right now. Some of them, their houses were affected during the earthquake. Some of the houses were affected after the earthquake or the second shock. And some of them are severely damaged and people cannot go and stay there. And there's yet more to come. So this is just initial preliminary figures. In Latakia, it was estimated around 142,000 people that are in the same situation and same condition. So when we talk about the level of needs and gaps and the destruction, it is massive. When we talk about health facilities, because the question also asked about health facilities, there are several hospitals that have been affected. Maybe not all the hospitals have been destructed, but there has been an impact on the infrastructure. Some of the primary healthcare centers have also been affected by the earthquake. But what's most important is the precious equipment, the heavy equipment that they had, which are needed for diagnosis, such as X-rays and CT scans. I have seen a CT scan that was bought in 2006 and it was still operational until the day of the earthquake. This CT scan, it was not operational after the earthquake because it fell down and it broke. They needed that type of machinery was really needed during this emergency, because in order to be able to diagnose the case and to find exactly what needs to be done, you need to have the proper diagnostic and imagery devices. So this is the level of devastation, which is a compounded emergency, which is, I mean, affecting the most recent emergency is the earthquake. But the level of vulnerability that this system has been suffering for the last 12 months, 12 years, have affected the health system severely. So I would like to ask if Dr. Rick would like to add anything before I go to the next question.
Yeah, I mean, I think that in terms of some of the other health issues that we're looking at right now, even prior to the earthquake, we had an ongoing outbreak of cholera, measles. We still have the pandemic. So addressing the infectious disease issues is an important part for us. So preventing and controlling disease outbreaks is an important part of the response. Mental health issues are huge. We've seen how people have been greatly impacted. It's been a very emotional experience, particularly over 12 years of conflict and deprivation. As one of our colleagues told us, even through the war, you at least felt safe in your home, but you don't even feel safe in your house right So it's hard for many of us to relate to that, but going out and seeing the communities, we see how emotional and how this has really strained them. So the trauma care, the essential health care, the disease control, the mental health, the coordination, the distribution of supplies. WHO is doing all of that, and we are scaling up.
Okay, I think we have a question from Suman. Suman, are you back online? Are you muted, Suman? If you can unmute yourself and introduce your agency, please.
We should put in the chat.
Something on the chat, Ines?
No, there's nothing in the chat.
Okay. Okay, colleagues, any question from the floor before we close? Well, yes.
I have some questions received, if I may.
Yes, please, Muna, go ahead.
سؤال من القاهرة الإخبارية يقول الاستجابة الدولية للمطالب الخاصة بإيصال المساعدات الطبية إلى سوريا كيف تقيمونها في ظل التعقيدات المرتبطة بهذا الملف؟ وما هي وقد أطلقتم تحذيرات من ده سؤال آخر أطلقتم تحذيرات من نفاذ مخزون الأدوية والمساعدات الطبية في شمال سوريا، ما الذي تأملونه من المجتمع الدولي للتعاطي مع الوضع الكارثي الذي خلفه الزلزال؟ السؤال من صبري السكري.
First of all, Muna, I think I would like to first to take the first question, which is on the aid, the humanitarian aid that have been received so far. I think, Muna, I would like to stress that the international community, together with, I mean, there's a lot of commitment and there's a lot of willingness and there's a lot of efforts that are being exerted on the ground. And the support is being exerted, but I strongly believe that we need to scale it up because the level of destruction and devastation is quite high. So this is in response to your first question. The second question, can you repeat it, please, Muna?
English.
Can you repeat it in English?
In English, you have warned that the storage or the stock of the medicine and medical supplies in North Syria is about to finish or to be exhausted. What do you hope from the international community to interact with this catastrophic situation after the earthquake? It's more or less linked to the first question.
Rick, do you want to take this one?
Yeah, so as Iman said, we are all working together with our international partners to scale up the response. Something this acute and this massive, you can never be fully prepared for. We could never have enough stockpiles to prepare for the needs of 5 million impacted people across northern Syria. So we have already mobilized, as we've mentioned earlier, the supplies we did have in country. We do have a plane arriving in 2 or 3 hours with 34 metric tons of supplies. We'll have another plane arriving in a couple of days' time. And this is the start. This is part of the scale up that Dr. Iman was referring to. We're not doing that in isolation. We're doing it in very close consultation with our government counterparts. We've already met 3 times with the Minister of Health in the last 2 days. We've met twice with the governor, so we can get a better sense of their needs and their priorities. And I think we're very well aligned. We're working hand in glove with our other UN partners and NGO partners. Something this acute, it's always chaotic, and we are working to get better organized, better aligned, and I think with every hour and every day you'll see a much more effective aid effort. We're putting out an appeal today. WHO is putting out an appeal for Turkey and Syria for over $40 million. We're putting out an appeal with the UN as well, and through that we're asking for another $15 million. So given the resources, we will be able to scale up very, very quickly, but we need the funding. Syria, let's be frank, has been grossly neglected for many years. And the health system, as Dr. Iman and Dr. Ahmed have said, has declined because of the neglect. The resilience of the health system has been exhausted. So we need the funding. We need to scale up with the resources and support our Syrian colleagues to deliver for their people.
Thank you, Rick. Maybe one thing to note, I think it's important because we saw it ourselves yesterday. We visited hospitals and we saw the commitment of the healthcare workers. These are the heroes, and in my personal opinion, and I'm sure my RD and the Dr. Rick believe, I mean, I have the same opinion. They have rise up to the occasion and they have been working non-stop in order to address the needs of all casualties. So they have been able to address the casualties, the immediate casualties, let's say the hot cases within the 24, 48 hours with the meager supplies and capacities available to them on the ground. But what they need right now is more support for them to be able to sustain and to continue, because the way they are, I mean, with the current level of support and capacities, they will not be able to sustain it. So I will take another question from the floor. I think it is Mr. Thilo Spahel. Mr. Thilo, if you can introduce yourself, please, and introduce your agency. The floor is yours.
Hello, I'm Thilo Spahel. I'm from ARD, German Radio and Television. I just wanted to ask, what are your main hubs to get your help into Syria? And are you looking for more ways into Syria, and which ways in particular?
Yes, Mr. Thilo, I will start and then I will give it to Rick if you want. I mean, we are adopting all modalities approach. So from our side, from WHO side, we have our main hub in Dubai. So this is where all the supplies are being shipped from. But we are also coordinating closely with our office in Gaziantep, and to ensure that the supplies, I mean, are to be distributed from both sides. But I leave it to Dr. Rick to go into more details, please. Thank you.
Yeah, so again, I think it's important to highlight our operation includes, with respect to Syria, I'm not talking about Turkey right now, but with respect to Syria, we have two main components. There's the work into the northwest Syria that can only be, that is largely accessed cross-border and cross-line, and then the government-held areas. So we are scaling up our operation in both areas. As Dr. Iman said, with respect to the area of the northwest, we use an all modalities approach. That means that we're scaling up our cross-border operation, which we referred to earlier, and we're working with our UN partners to explore options for expanding the access from Turkey, southern Turkey, into Idlib province. At the same time, the UN has been operating what we call a cross-line operation from the government-controlled areas of Syria into Idlib. That's involved one convoy per month over the last year. We are very keen to really elevate that substantially because we need to address the gaps. So we are getting facilitation from the local authorities here. We are working with our UN partners to ensure that we can get access cross-line from Syria into the northwest as soon as possible. In terms of bringing aid into Syria, we're using a combination of measures. As I've said, we've got 2 airlifts due in the next 48, 72 hours. Somewhat fortuitously, we have a ship coming in the next week or so with trauma kits. And now, as I mentioned before, we're appealing to the international donors to give us the funding so we can scale up our response, because as we mentioned, last year for all the humanitarian needs in Syria, we only got funding for less than half, 46%. That just falls well short of what the Syrian people need. So we really do need the donors to get behind us so we can bring in more assistance.
Okay, let's go to Abbas. Abbas, if you can introduce yourself and the news agency, and the floor is yours.
السلام عليكم ورحمة الله تعالى وبركاته. أهلا وسهلا بكم. أهلا وسهلا بكم. نسأل الله السلامة على سوريا وعلى تركيا وعلى العالم أجمع. ونشكر السيد بشار الأسد.
Yeah, maybe.
Okay, Abbas, we lost you. Are you still online?
Dr. Iman, if you want, I have a question.
No, I still have two more people, Muna.
Okay, thank you.
Okay, Abbas, we lost you, unfortunately. We can go to the next requester, Ashvan. Ashvan, can you introduce yourself, please, and the news agency you are representing? The floor is yours.
Thank you for considering my question. This is Ashwin Barshinge from Observer Times India. My question is, there are devastating movements in the Turkey and Syria. At least 4 lakh people has displaced from their home. My question is, what WHO's roadmap to get the humanitarian access and to mobilize mobile hospital for the displaced people in Syria and Turkey? Thank you.
Rick, you want to take this up?
If your question is directly about bringing in mobile hospitals, we've done assessments. We've worked with the Ministry of Health here in the government side of Syria. We don't believe we need to bring in mobile hospitals, field hospitals into Syria at this stage. We do have a trauma specialist that arrived in country within 24 hours of the earthquake. And I think that together with the government officials, the Ministry of Health officials, we've been able to organize a good, a solid response to the trauma care involving referrals between hospitals and so on. So there is not the need for field hospitals. There's the need for the type of supplies and equipment that Dr. Iman and Dr. Ahmed and I have been speaking about, trauma kits, x-rays, CAT scans, and so on. So now, in the northwest side, we are looking at options for bringing in international teams. There are more complexities about bringing those teams across border. We haven't got final clarity about whether that will be possible, but there are a number of complexities there related to operations, related to access, related to security. But we are exploring bringing in 1 or 2 international teams to provide surgical, trauma, surgical and other urgent care into the northwest, into Idlib. But we have not finalized any arrangements at this stage.
Thank you so much, Rick. I think we have room for 2 more questions, and I have 2 people online. Veronica, please introduce yourself and your news agency. The floor is yours. Veronica, can you hear us? Okay, I have Nina. Nina, can you introduce yourself, please?
Yes, hi. This is Nina Larson with AFP. I'm sorry, I missed the beginning of this press conference, so I'm sorry if this is asking you to repeat something that you've already said, but I'd be interested to have more details on how much aid you're expecting to bring cross-line and also across the border the one border crossing in the days to come, if you have sort of amounts and what kind of aid that is coming in. Thank you.
Okay. So on the let me start with the cross line. So we have you may know that the cross line operation right now, it involves one UN convoy per month into Idlib in northwest Syria. Even before the earthquake, we were looking at options to expand that operation to at least 3 or 4 convoys per month. Now, of course, there's a greater sense of urgency, and we are looking at all options to expand that cross line. We have facilitation and from the authorities and flexibility from the authorities here in Syria, and we are still working with our UN colleagues to ensure that the next convoy does go ahead. We will, given the earthquake and the new acute needs, will be, of course, including trauma kits, surgical supplies, and so on, as soon as we get the green light. As soon as we get the green light, we're ready to go. And we are ready to, not only for the next convoy, but of course, expand. Of course, we're limited to about 18 or 19 trucks per convoy, because we're sending in food aid, we're sending in shelter, and so on. So, the initial convoys won't have as much medical supplies as we would ideally like, but we will go to scale. In terms of cross-border from southern Turkey, I mentioned before you joined probably that we already had supplies pre-positioned. We had trauma and surgical supplies immediately distributed from our stocks to 16 hospitals. The first convoy that went in the last 48 hours, the 6 trucks, we only had a very modest supplies there. We've got about 20 tons that have arrived in southern Turkey within the last 24, 48 hours, and they will be trucked as soon as we can. You know that the Bab al-Hawa border crossing was blocked for several days. Now we've got, we're starting to scale up the use of that. We have about 15 to 20 metric tons of supplies ready to go in. We've got another air shipment due to arrive, I think, of between 30 and 35 metric tons. Again, trauma kits, essential health supplies, that should arrive in southern Turkey within the next 48 hours. We hope that, there's a lot of congestion at the airports as well. So, and again, the UN is looking at options for expanding the cross-border access. We're all part of that. And as soon as we expand access, we'll be delivering more assistance.
Thank you so much, colleagues. We have come to the end of our press briefing, but I would like to give the chance to our regional director, maybe to provide us with his closing remarks. Thank you, Artie.
Thank you very much, Iman, and thank you, colleagues, for joining us into this important briefing. Thank you, Rick, as well. I'll give these briefing remarks, closing remarks, both in Arabic and English. I'll start with the English one. Colleagues, the whole world witnessed how much Syria and Syrian community and individuals have suffered for the last 12 years because of the war. You have all came across, the destruction in the different systems within the country, including the healthcare system. So my concluding remark in English for this one, enough is enough. And that is the motto we need to bring through you, colleagues, to the whole world, that enough is enough. And let us help Syria and Syrian people rebuild their country. It is a very beautiful, very historical country. The community is resilient, but they cannot tolerate it anymore. The earthquake came in a very bad timing, and it has destroyed whatever minimum capabilities or minimum strength Syrians are having. We have witnessed it on the ground, as colleagues have mentioned, today and yesterday and the day before yesterday when we met here. We have seen families, we have seen brides lost their lives while hugging each other, because of a collapsed building. We have seen a young child who lost his mother, and he is like, psychologically very disoriented. We have seen men lost their whole families, wives and children. We have seen in the hospital ladies who have lost their children and their husbands are in the critical care. You know, God knows that they will come out. So please share with others, you know, through your channels, the suffering Syria and Syrian people have come across on this. And enough is enough. Now I'll give my briefing in Arabic. اخواني واخواتي جزاكم الله خير على الانضمام الى هذه الاحاطه الاعلاميه. كما تعلمون يعني سوريا والشعب السوري عانى من ويلات الحرب لمده 12 عام. ادى الى تدمير بنى تحتيه قويه جدا، من ضمنها طبعا النظام الصحي. النظام الصحي في سوريا كان يعتبر من افضل الانظمه. الان يعاني من هشاشه مخيفه جدا لا تتحمل اي كارثه اخرى. اتى هذا الزلزال وقضى على ما هو يعني بسيط من الطاقه والقوه في النظام الصحي وكذلك بين المجتمع السوري، لكن كما ذكر ريك يعني وجدنا الايمان، وجدنا الثقه في الله، وجدنا الرجاء من الجميع المساعده. فلذلك يعني وصيتي اخواني واخواتي يعني من خلال منصاتكم الاعلاميه ان نقول للعالم كفى. ما مر به سوريا وما مر به الشعب السوري خلال 12 سنه حرب، واتى هذا الزلزال ليقضي على ما تبقى. كفى علينا ان نقدم كل العون والمساعده لسوريا والشعب السوري بغض النظر عن مختلف التوجهات والاجندات. فجزاكم الله خير، ونتمنى انكم توصلوا رسالتنا الى الجميع. كفى يعني خلاص، علينا ان نرجع لسوريا ولاهل سوريا لتقديم المساعده لهم بكل ما تعنيه الكلمه. جزاكم الله خير، مشكورين على المشاركه. Your participation is much appreciated. Looking forward to have you again ان شاء الله in another press briefing. الله يحفظكم جميعا وجزاكم الله خير. Thank you very much. Thank you, Iman. And
thank you, colleagues. Really appreciate it. Thank you, Rick, and thank you, Adi.